any cyanosis, any peripheral cyanosis?
No, there is no cyanosis.
Any clubbing there?
No clubbing.
What about the perfusion?
Dr. Wakar is back.
It's okay.
You can start over.
Continue, doctor. Because my net is a problem, so you continue.
Okay. Okay.
Okay. What about the perfusion?
Perfusion is okay.
Okay, then what about the pulse? How
Pulse
many
is,
beats per minute?
110 per minute. Good
Is
volume.
it regular? Yeah, good
Regular
volume.
and good
Doctor.
volume.
Yeah, what about synchronicity? Is it synchronous?
Yes.
I will check radiofemoral delay at the end. Also, I will check the blood pressure at the end of my examination. Then what about, I will check for the pallor, any pallor in his eye?
No pallor.
Any jaundice?
No jaundice.
Okay, let me check the mouse. Any central cyanosis?
Not cyanosed.
What about the mouse hygiene?
It's okay.
What about the neck pulsation? There is any visible pulsation in the neck?
No.
Okay, let me comment about the chest shape. Is it normal chest shape?
Yes, normal with scar, visible scar.
Okay.
Centered.
Okay, what about, where is the scar?
Scar is central sternotomy. Median sternotomy scar.
Okay, there is any other scar? I mean, lateral thoracotomy scar, right or left?
No, boss, there's no other scar.
Okay, any visible pulsation in the chest?
No, there's scar on the left side, sorry. There's one scar.
One scar in the lateral side. You mean right lateral thoracotomy scar?
Left.
Left, okay, left thoracotomy scar. Okay, what about the auscultation? No, I was sorry. First, the apex beat. Where is the location of the apex beat?
I'm sorry, come again.
Apex beat location.
It's fourth intercostal space.
Okay. Then I will auscultate. I will check for Cyril in the fourth area of Cyril. Any Cyril there?
No thrill.
Okay, I will auscultate for the first and second hard sound. Is it normal?
No, audible, normal.
Oh, audible, normal. Any added sound, any murmur?
There is a murmur.
Where is it?
It is left lower sternal side.
How much intensity?
It is grade 3.
Okay, grade 3 murmur. Okay, it is radiated or localized?
All over the pericardium.
All over. Okay, all over the pericardium. It is changed with position or posture, or it is just no change?
No, it's not changing with the position or posture.
Okay, then I will palpate the liver. Is the liver palpable for this patient?
No, boss.
What about the lower limb edema?
No edema.
Okay, now I will examine the back. Is there any visible scar in the back?
Yes, there is an extended scar.
What scar?
There is a lateral thoracostomy scar that is visible from back side, left side.
Okay, then I will auscultate the back for any basal crackles.
No, boss, no basal crackles at all.
Okay. Then in order to complete my examination, I will measure the forelimb blood pressure and also forelimb oxygen saturation. And what else?
Don't know.
Okay, finished.
Okay, can you tell me your positive findings?
Okay, today I examined Jack, 2 years old boy, looks well. He had some syndromic feature going with Down syndrome.
Very good.
Pulse rate 110 beat per minute, regular. He has central sternotomy scar, and also left lateral thoracotomy scar. He had the pan-systolic murmur on the left lower sternal border, grade 3 murmur with here all over the precordium with maximum intensity in the lower left sternal border. There is no sign of heart failure, and there is no stigmata of infective endocarditis.
Okay, very good. Doctor, what is your possible diagnosis for this patient?
This is a patient with Down syndrome. He had completely corrective complex congenital heart disease.
Complex congenital heart disease. Okay. Doctor, tell me why this murmur is audible. Still, he has murmur. Why?
This is maybe a residual murmur.
Okay. What else?
I don't know.
Okay. So, what is your diagnosis?
This is completely corrective congenital cyanotic heart disease in a patient with Down syndrome.
What possible of the cyanotic heart disease?
It may be okay. Maybe a tetralogy of Fallot.
Okay, very nice. Okay. And what else?
AVSD, but the problem that the patient has left lateral thoracotomy scar.
Okay.
In AVSD, it will be only just central thoracotomy scar.
Okay. What are the possibility of the left lateral thoracostomy scar? What are the differential?
Maybe a BT shunt done.
Okay. Okay.
Okay. Maybe there is something in the left, in the right lobe of the lung, lobectomy, or any surgery for lung surgery.
Okay. What else? What lung surgery other than lobectomy here?
Maybe tracheoesophageal fistula can be done here.
In the left side, doctor?
I'm not sure.
Okay. Okay. How you manage this child?
Yeah, okay. Multidisciplinary team involving pediatrician and cardiologist. The nutrition input is very important in this patient.
Very good.
Yes. My patient not inferior, so no need for admission and emergency management right now.
Okay. So what you will give the advice to mother for this child?
Advice to the mother: if the child become more distressed, fast breathing, she can see an emergency. Doctor.
Okay. Okay, very good attempt, Dr. Nihat. Really, you did a good job. But something you missed, like, yeah, you give the possible diagnosis that is acceptable.
Okay.
And you explain everything that was
Okay.
mandatory in this area. But you didn't bother to see the neck, right?
What?
You didn't see the neck.
Nick, I see only. I asked for any visible pulsation. You said there is no visible pulsation.
No, but,
JVB. I think the child is still young to check the JVB. Okay. Am I right?
No. Other pulsation and see the murmur radiation. You didn't see the neck side. Okay. And secondly, any child who was an infant, you should see the first auscultate the chest first, because maybe before if you start handling from periphery, maybe child get irritable and he start crying. Yes, so you won't be able to get the finding, which is any exact finding. Okay.
Yes, you are right.
So always try to handle the baby from the chest. Okay. For auscultation first. Okay. And secondly, then you can comment on the clubbing, cyanosis, infective endocarditis. So before giving description, you should say, my child 2-year-old looks well and not in distress and not clubbed. This negative thing to exclude, meaning he is not in failure. He is pink in air. Clear?
Okay.
And okay, I ask you the possible of the left lateral thoracotomy scar. Possibility is that number one, Vitishan, PA bending, because he has the VST. Okay. So sometimes because of the high pulmonary blood pressure, high pulmonary hypertension, we used to do PA bending first before the correction. Okay, the PA bending is a possibility, number one. Number two, Vitishan. Number three is the lobectomy. Number four is the coarctation of aorta. They can do, and PDA ligation. Right, left side is a possibility. And left side, you can have lobectomy, you can have tracheostomy fistula, you can have the Vitishan. Clear?
Yes,
So,
clear, sir.
yeah, these are the things, and when you ask, they are asking possibility of the left side thoracotomy scar, you can say like this. Okay? And remaining, you did good job. It was nice. That's good. Because your baby is pink.
Yes, Dr. Nihad, you did really very good. Your steps were already, you know each and every step. So that's why Dr. Irfan catch you, that child is small, so that you start with auscultation.
Yes.
So this is the drawback when we memorize each and everything by tips. So
The crux is that when you start examination, just have 30-second look and plan yourself how I will take this child, how I will handle from the chest or from the hand. If you recall all these things, then you will never do the mistake.
So have you examined both hands, Pulse, both hands?
She told, and then I will do the delay.
And sacral edema?
I think she
only lower lip.
And what about the lymph nodes, neck and backside of the neck?
No, it's not
Down
mandatory in the CVS.
Not neck?
And not in the CVS station.
What about
yes, you can.
epic? She said about both side, or epics only one side? She said.
No, she said location. I thought left
Auscultate
side.
all, yes. Auscultate
But she didn't mention this thing that apex beat is where. I told left side, fourth inverse space. I told her.
Okay.
Okay, and other thing in Down syndrome, you said the features of Down syndrome. That is good.
Yeah.
So at that time, you should say that I would like to plot his weight and height according to the Down syndrome growth chart. It's very important.
Yes, right. Yeah, that should be mentioned. But and I suppose you are in a stress condition, and already you mentioned that patient is Down syndrome. So and your examination technique is very sophisticated, and you did all the
Dr.
steps.
Irfan, I want all of in this group, inshallah, they will get the highest mark. So we are preparing for the highest mark, inshallah.
Inshallah.
So, we will not miss these things.
No, you're right. Yeah, this is a good point. Yeah. We will do practice daily, and this exam is quite verbal. Quite verbal. If you are good spoken, it is 50%, 60% you can pass easily. It is spoken with the good spoken language skills.
Good step approach.
Yeah, step approach.
Stepwise approach. See, if these steps she will use on any cardiac examination would be the same. There wouldn't be any change, right?
Yeah.
So only the thing is we have to memorize a step, because many things we will not do each and everything in the CVS.
So what we can do next time, I will prepare some differential. Okay, how to diagnose. When suppose patient is having central sternotomy scar and lateral scar, so what possibilities you should ask? And pink child, number one, then Sanos child. So if we recall all these things, you will not miss the diagnosis also. I will give you a good approach in the next meeting, inshallah. So I will give you the what are the tips and how to assess, how to connect the things, and said possible diagnosis. That will be very, very helpful, because CV station is the same like a mathematics.
Yes, right. So anyone else has the comment on this examination, clinical station?
I think she did good actually. Good.
Yeah, she did good job.
Dr. Nihad, how did you memorize these steps? Please let me tell your experience.
Just when I am examining, when I am called the examination, I imagine that I am in front of the child and I will go step by step. From hand, then up to the area of blood pressure, this arm, then I will keep, if the patient is elderly, up to I will comment on the axilla, it is also up, just going up. Then I will go up to the eye. I will then go down to the mouth, then neck, then chest, inspection, palpation, auscultation, then abdomen, then lower limb, then back. Like
Are you
this.
doing the real patient in your clinical this
No,
setup? Now?
on a doll, I am doing on doll, not on a railway.
Okay.
Doctor,
But you are doing the practice these steps.
Yes.
Dr. Waqar, this one, PDA will be on the left side only, right? PDA ligation.
Yes, PDA left, not on the right.
But PA bending can be on both sides.
No, left
PA
side.
bending even left. PA bending even left.
PA bending left
So
side,
on the
PDA
right
left
side,
side.
there are three things like tracheoesophageal fistula, repair,
Lobectomy,
lobectomy, and the
BT
BT.
yeah. Three are
That's
the
it,
left,
yes.
Right side, yeah. And
Left
sometimes
side,
you can,
BT
left
shunt
side
can
is
be both
PA
sides.
bending,
Wait,
PDA,
yeah.
BT shunt, and coarctation, lobectomy. These are on the left.
Five.
BT shunt can be both sides.
Yes.
Yes.
But as per
Most of
yes, both sides. See the right sided things all in the left side you can consider, right?
Okay.
But you have to add two more things,
Yeah.
like PA bending and pulmonary artery PDA ligation.
So PDA not on both sides, only on the left side.
On the left side. Yes.
Yes.
And PA bending also only on the left side,
On
not
the
on
left
both
side.
sides.
Yes. True.
Yes.
Okay.
So it was good session, but my internet was having disconnecting again and again.
Okay.
Anyways, next meeting in Saturday, I think. Yes, Saturday, inshallah, I will post on the group. The other thing I'm going to study maybe tomorrow, I will post on the group if anyone wants to join. For new guidelines they send on the website of RCPCH. So I think 2-3 pages or 4 pages maybe. We have to read it
For what?
2-3 times so that for these new exam guidelines, online exam guidelines, because there are some changes.
Which
we
time?
should have to be familiar. Maybe tomorrow in the afternoon or evening. I've sent on the group. Inshallah.
Okay.
If you are interested to join, you can join. We will discuss this. I will read and we will discuss here. Yeah.
Okay. Thank you so much.
Okay. Thank you. All.
Thanks, everyone.
Dr. Hiren, this recording, please.
Yeah.